Did you know that certain types of persistent itching could be a hidden alarm from your body? Especially for those over the age of 60, recurring itchiness in specific regions may not be something to overlook. What appears to be a harmless skin irritation could, in fact, be an early warning sign of internal changes, sometimes even cancer. In this video, we're going to explore 5 unusual but critical areas where persistent itching has been linked to underlying malignancies. This isn't about causing fear. It's about tuning into your body's subtle messages before they become louder and harder to treat. Let's start with the scalp. For many older adults, an itchy scalp is often dismissed as dryness or an issue with shampoo. But when that itch feels like a tingling or burning sensation, and it doesn't go away even after changing products or using treatment shampoos, it could be something more. In some cases, such persistent scalp itching has been tied to early signs of leukemia or skin cancer on the scalp. These sensations aren't caused by the surface of the skin, but rather nerve irritation triggered by immune system abnormalities. If the itch lingers and doesn't respond to anything topical, it's time to consult a professional. Next, let's talk about an area that many feel too embarrassed to mention: the genital or anal region. While occasional itching in this area is common and usually harmless, consistent and unrelenting irritation without an identifiable cause can be concerning, especially when it doesn't improve with hygiene adjustments or over-the-counter creams. In older adults, this kind of persistent itching has been linked to cancers such as anal, vulvar, or penile cancer. The discomfort may present as rawness or burning, and while it might not seem serious at first, it can signal changes in skin cells or deeper issues. It's vital to overcome the discomfort of talking about this and seek medical advice. Another frequently ignored area is the upper back, right between the shoulder blades. This itch is often thought to be due to dry air, clothing tags, or posture issues. But if it feels like the itch is coming from under the skin and persists regardless of lotions or scratching, it may point to something deeper. Studies and patient stories have linked this symptom to pancreatic cancer. The mechanism involves bile duct blockage, which causes bile salts to enter the bloodstream and irritate nerve endings, particularly in the back. It's subtle but significant. Now let's move to the chest and breast area. Both men and women over 60 should be alert to persistent itching in this region, especially near the nipples or under the breast. Sometimes the skin may appear normal or slightly roughened or discolored. This could be one of the first signs of inflammatory breast cancer or other tumors in the chest wall. Unlike more common cancers that start with a lump, this type may first present through skin changes or irritation. Any focused, unrelenting itch in this area deserves attention, especially if it's paired with warmth, tightness, or a change in texture. Finally, don't overlook the lower legs, particularly the shins and calves. When older adults develop an itch in this area that doesn't respond to moisturizers and comes without rash or obvious irritation, it could indicate a deeper issue. Lymphoma, a cancer of the lymphatic system, often starts with systemic symptoms that are hard to detect. Persistent itching in the lower limbs, especially if it worsens at night and seems resistant to skin treatments, may be a neurological response to inflammation caused by cancerous activity in the lymph system. The goal of this video is not to raise alarms, but to increase awareness. The body often whispers before it screams. And for seniors, those whispers might come as an itch that won't go away. So pay attention to persistent sensations, especially when they're located in key areas and don't respond to typical solutions. If you've been dealing with any of these symptoms, don't hesitate to bring them up with a healthcare provider. Early attention can make all the difference. If you found this video helpful, please leave a comment using the word "Ikasatsu well past 50" and let us know which insight was most useful to you. Don't forget to like, share, and subscribe for more health tips and early warning signs every older adult should know. See you in the next one.